Dear professors and my colleagues and dear audience, first of all, I would like to thank the organizer of this conference for the opportunity to present our work in front of you. So my name is Sena Para and my supervisor is Professor Dr. Behaviour. The title of the presentation is The Investigation of the Effects of fisetin with the Combination of Chemotherapy Drug Temozolomide to the Biological Behavior of glioblastoma cells. The content of this presentation starts with the information about brain tumors and my data and ends with the conclusion. So what we consider as a brain tumor is that it causes uncontrolled cell growth to the abnormal cells grow enough over time to cause a pressure in the head. So the epidemiology of brain tumor, if you look at the epidemiology, we can see that it covers 1.6% of all cancers and 2.5% of all the deaths in the world. And if we look at it in Turkey, the mortality percentage increases to 4. So what is the glioblastoma? It is the most lethal, most aggressive, largely recurrent and treatment-resistant primary stage 4 brain tumor. The standard glioblastoma treatment, first we have the glioblastoma occurrence and we diagnose it and they apply the surgical resection. And the next step is the chemotherapy and the radiotherapy. But the current median survival is only 12.6 months. Temozolomide is the most common chemotherapy drug used in glioblastoma treatment. It is a DNA alkylating agent. Due to its small size, it can cross the blood-brain barrier. That's why it's commonly used. The basic logic is that it's hydrolyzed to its active metabolite, and after the placement of methyl groups, it creates a mismatch base pair and ultimately leading the cell to apoptosis. Fisetin. So I'm going to talk about the flavonoid is called fisetin. It points out that the investigation of the anti-cancer effects of flavonoid may give a rise to the potential of discovering new therapeutic candidates of the treatment of glioblastoma. Fisetin is a natural polyphenolic flavonoid commonly found in strawberries, etc. Has been shown to have antioxidant, anti-inflammatory, and anti-cancer properties in many cancer types. In this context, the effects of fisetin, which is commonly found in the structure of radiotherapeutic plants and can also be used as a food supplement, on anti-cancer and temozolomide-resistant glioblastoma cells will be investigated. In addition, there are many pathways which are of great significance in temozolomide-resistant glioblastoma cells are also targeted by fisetin. Due to the presence of common pathways involved in temozolomide resistance and targeted by fisetin, it was anticipated that fisetin would be a guide for obtaining positive results in temozolomide activity and resistance. So, objective of the current project is to examine the effects of fisetin combination with the temozolomide and in vitro cell viability of the T98G temozolomide resistant cell line on the invasion and the colony formation if they associated with the aggressiveness of the tumor. Thus, it is aimed to reveal the usability of fisetin in vivo and in vivo studies and its potential to be evaluated in the advanced project. So aim 1 is the determining of the active doses of the fisetin in combination with temozolomide and determining its effects on the cell proliferation. Aim 2 is to examine the possible effects of fisetin and temozolomide alone and in combination with each other on the suppression of tumor aggressiveness in vitro tumor environment and their functional relationship with the ability to invade and colonize. So what we have is, first we have the temozolomide resistant cell line, and we apply the steps of counting optimized number of cells for the experiment via cell counting system. Then we treat the cells with the flavonoid, fisetin, and the temozolomide according to our experimental groups. Cell proliferation analysis is done with the excision system using the 16-valve epolate, and then we We do the invasionability experiment. We have wound healing assay and colony formation assay. So here are the results. With the cell proliferation assay, we determined that fisetin deters cell proliferation. Cytotoxicity of fisetin on the cells was evaluated by a high-tech excision system. And here we have the fisetin treatment after 24 hours and IC50 values calculated after 24 hours of incubation, 16.4 micromolar for T98G. With the wound healing assay, we have the cells were treated. We have the cells that are treated with the effective dose of fisetin for 24 hours again, and then images of wounded subconfluent monolayers of cells treated with the fisetin were taken at different hours. A percentage of the wound wins were plotted, and then, as you can see here, control cells are untreated cells with high metastatic and wound closure ability. An open wounded area in temozolomide and fisetin combination group is 98%. So according to this, it means that only 1.97% of wounded area is closed for the temozolomide and fisetin treatment. So as a conclusion, fisetin suppresses the sun invasion alone, and even better in combination therapy with temozolomide. With the colony formation experiment, we have found that temozolomide and fisetin combination therapy inhibits the number of colonies formed. As you can see from the photos, the combined therapy decreased the colony number 99.58%. So it's like 235.3-fold more compared to the untreated cells. In the literature, the effect of fisetin on apoptosis with its senolytic effects on the T98G cell line, and also the effect of fisetin on glioblastoma senescence in another glioblastoma cell line were mentioned, but its effect on cell aggressiveness in combination with temozolomide were not shown. There are very valuable resources to provide preliminary findings for the studies we have done and will do. However, the effect of fisetin combined with the temozolomide in the temozolomide-resistant cell line on the biological behavior and the cell aggressiveness of the glioblastoma cell line will make a contribution to the literature and the future studies. As a conclusion, overall, the results show that fisetin treatment with the combination of temozolomide and glioblastoma can reduce the tumor aggressiveness, which can pave a path to us to understand anti-cancer activity of a widely used natural product even better. Consequently, important findings have been obtained with the temozolomide combined therapy in order to lower the effective dose of the drug, temozolomide, thereby reducing the side effects and enhancing therapeutic efficacy of the drug, as well as postponing the resistance to the drug. Thus, it will be possible to structure in vitro and in vivo projects for the development of a drug candidate that will contribute to improving the survival and the quality of life of patients. Furthermore, the findings of our current study may shed a light on the development of new strategies that are more effective, with less side effects and more economical for the treatment of glioblastoma in the future. So thank you for listening. Here are my references. You can use it by scanning the QR code. And if you have questions, I'm here to listen.